whereas, since over 2,000, let me need my glasses. Let me make sure I get this number right. 239,100 cancer cases will be diagnosed in Canada this year. Increased access to quality cancer care, screening, and prevention must be a top priority in our community. And whereas the great city of Ottawa has an active and productive cancer survivor population, and whereas hundreds of communities worldwide will be celebrating life this week, therefore, I, Mark Sutcliffe, Mayor of the City of Ottawa, do hereby proclaim June 2nd, 2024, National Cancer Survivors Day in Ottawa, and urge citizens to join in this joyous celebration of life. There we go.
Canadian Cancer Survivor Network, when COVID started, did extensive surveys done by Leisure to determine disruption in cancer care caused by COVID. And I have for you here 3 reports. The first one is of the first 3 surveys, and it's called Thrown Under the Bus. And that was a quote from a cancer patient. During that time, over 40% of patients, 70% of caregivers, and 60% of people who were waiting to find out whether they had cancer or not, had appointments canceled or rescheduled during the pandemic. On average, they waited 55 days to get another appointment. And they, of course, they were all stressed out. Who wouldn't be? More than 50% have had their ability to work affected. And we know both from reports, but also for some people who we know quite well, that many people who were diagnosed after these delays were diagnosed later.
Absolutely.
And of course, what we need in this country is the ability to diagnose people early. And with improved treatments, many, many people survive. And that's us as cancer survivors. And the estimation is that now in Canada, there are 1.5 million cancer survivors.
Wow.
Yeah, wow. And so what we want to do is make sure that we get them. Now, one of the things that, we're not doing any more surveys. One of the things that we are doing is, and that's Nir who's smiling because he's doing a lot of it, is researching emergency preparedness plans across the country, federal, provincial, and then we've started with municipalities, but there are over 4,000. So we're picking and choosing where there are already some emergencies in terms of fires happening, especially in Western Canada. And we are looking at their emergency plan, and if it doesn't contain anything about health or cancer, we're asking that continuation of cancer care during future pandemics and natural disasters. And the name of our campaign all along has been Cancer Can't Wait. And during COVID, cancer didn't wait, which we know very well. So I'm pleased to be able to give you these 3 reports, and they're in both languages here for you. And to ask you to check whether or not, or have someone check whether or not continuation of cancer care is in Ottawa's emergency preparedness plans.
Okay.
Okay?
Yeah.
Okay.
And I don't know where that responsibility lies, whether that's at the provincial, I think it's the hospitals and the healthcare system and that type of thing. But
we were looking.
Happy to ask.
There's an emergency management program and a municipal emergency plan. So there are some resources, we couldn't find them online. Okay, so great to start in our own hometown with that.
Great.
Okay. So thank you so much.
Thank you, and thank you for what you're doing. I've you know, like so many families, my family has been touched by cancer, and I've done a lot of fundraising for cancer research in my life as a marathon runner and as a radio host. So really appreciate the work that you're doing.
Thank you.
Yeah. Thanks very much. Yeah, thanks for coming in. Okay.
We have 300.